Hi everyone, thanks for tuning in for us.
Hey guys.
I'm Naturopathic Dr. Emma Pollon-MacLeod.
I'm clinical pharmacist Adam Livingston.
So today on our Beakers and Botanicals segment, we wanted to talk about something that we've been hearing again and again, not only in the pharmacy, but also in clinical practice, and that's been anxiety.
Seems to be an epidemic of anxiety and mental health issues anyway, and then with COVID, it's been unbelievable seeing the surge of people coming in with anxiety, sleep problems.
Yeah, just overwhelming, especially now with back to school and the uncertainty and kind of, the anticipation of what the fall is going to be like. There's a lot of unease. There's a lot of symptoms that I'm seeing happen in people too. Like a lot of people are having gut problems, more hot flashes, and it's making them more anxious about their health. So there are a lot of contributing factors for sure. And there's a lot of expectations being piled up on people, and they're working from home, and it's just getting kind of crazy. So this is why we wanted to address this topic today.
Yeah, and talk a little bit about some of those sort of anxiety treatments or things you can do to help with anxiety that might be a little bit more on the healthy and sustainable side versus things that might be seemingly a good quick fix, but actually can cause a lot of problems. And I would try to help you to steer clear of some of those. And namely, one of the main medications that historically has been used for anxiety are called Benzodiazepines. And this is a medication that is actually quite effective for helping
So what would those be?
Yeah, I'm sorry. So Benzodiazepines are a class of medications. You've probably heard some of the brand names like Xanax or Valium, Ativan. These are kind of the most common ones. Things like lorazepam, diazepam, things like that. You've probably heard of a lot of them. They have made a lot of progress in terms of not over-prescribing these as much anymore. And in the Canadian guidelines, you're not supposed to use them beyond a couple of weeks, typically, except for very specific conditions. But you know, as a pharmacist and a lot of prescribers, you'll see people coming through that have been on these medications for months and even years, and in some cases even decades. And what people don't realize is they are quite helpful for anxiety short-term within a few weeks.
Too helpful.
Yeah, they work quite well. If you were very anxious and you took some lorazepam, it will work. I mean, that's the beauty of some drugs, is they work for sure. The problem is the side effect profile and also tolerance and dependence. So that's why it has now been put into most Canadian guidelines that you shouldn't really be using these medications beyond like 2 to 4 weeks max, because you will notice that you need to take more and more. That's called a tolerance to the medication to get the same effect. And also it'll become very difficult you'll actually get a bit of a physical addiction or a physical dependence to coming off of these types of medications. So they're often a very good quick fix. And I have a lot of empathy for prescribers, because if you have someone sitting in front of you, they're very anxious, you want to help them now. You want to get a quick result, and I get it. Problem is, a couple months down the line, if they're still taking these, now it can become a real mess. And this is a group of medications I work with and I focus on a lot when I work with polypharmacy patients and Deprescribing, and trying to get prescribers and patients to reduce these medications or not even go down this road in the first place.
Yeah.
Because, as a pharmacist, we often laugh because I'm like, we call these alcohol in tablet form in terms of like they're sort of a quick and dirty fix, and short term they're okay. Long term, they can cause a lot of problems, and there is some evidence coming out now that they can actually potentially permanently alter what's called the GABA receptor, and that's what they act on, and it's the same receptor that alcohol acts on. So you will see that acute effect of almost like having a drink. Like, yeah, it works, I calm down. But just like with alcohol, if you keep doing that every single day and you're drinking more and more, you're taking more and more of your benzo every night, you can see how that's going to become a problem over time. You're going to get tolerance, you're going to get dependence. A lot of people, they take more and more and more, and then it stops helping with their anxiety. And then trying to get them off, they have really bad withdrawal. So getting deep into these medications and going down this road and taking these long term is one of the messiest situations I see as a pharmacist, for sure. And I work with patients that literally have been trying to taper off of these for years, and they are coming down, but it's such a slow and difficult process. And some of them literally lose the ability to relax the way they used to be able to.
Yeah, so, I guess the reason why we wanted to talk about this, obviously Adam's very passionate about this subject, which is why...
Well, I see patients get absolutely trapped in almost a nightmare situation. Yeah. And you start seeing people where they can't calm down anymore.
But what we're seeing is right now, we've recognized it in patients, the anxiety, the desperation, the inability to sleep and calm down. And so a lot of people are like, I'm just going to go to my doctor. I just need something right now. And it's so easy to, as a practitioner, you know, I don't really know these things. I'm not a pharmacist either. So you say, you know what, like you're in a really acute phase. Like, let's just give you something to calm down right now, just so you can just get some relief. And, you know, there's other things to try and do because of the long-term effects and what Adam is talking about. So people don't really understand that, and it's not really talked about. And I think if it's talked about more, there would be more of a barrier to starting that, or maybe people would question it or be more educated about what they're about to start consuming, right? Like you should know the real risks, and sometimes I think that's really not discussed. And if you've ever spoken to someone who's tried to come off long term, like they will give you this type of background. So when we're talking about anxiety right now, we're trying to kind of bring a lot of awareness to, if you're struggling right now, there are a lot of things we can do, but a big message we wanted to kind of convey is, you know, it's okay that you're anxious and struggling. It's uncomfortable.
And if you are using a benzodiazepine medication, we're not judging you for going down that road. We work with tons of like high functioning, intelligent people that have gone down this route, and it's okay. There's nothing inherently wrong with it. I'm just trying to prevent you from getting yourself into a tough pharmaceutical situation.
Yeah, we're just trying to bring awareness because there's a lot of anxiety and we're seeing a lot of people struggle. A lot of parents at home are really, really, really struggling, and they like really need sleep. And so, I mean, again, I don't have this experience with people on benzos. Like I know that, like I have patients where some of them, they just have one prescription and it'll last them a full year, and they'll take it for like extreme panic attacks or really intense nights of not sleep, which is, to me, that's like the real use of them. I guess what we're just saying is it works so well, it can be a really slippery slope when you don't even realize that. So right now, it's a really kind of tricky time because people are desperate. And so this is like a prime opportunity for a lot of new people to start using these medications that could potentially be very difficult to come off in the future when things have settled down a little bit.
Yeah, it's the quick fix thing, right? If you look at the Health Canada statistics on like alcohol and cannabis use right now, and benzo use has definitely gone up too. Everybody's anxious right now. Everybody's reaching for the quick fix. Mm-hmm. Be cautious, because we've seen people even in the last 5 months with COVID start on a benzo, and now we're trying to taper them off. Or we've seen some of our patients that are like drinking more. There's a lot of people are reaching for these short-term Band-Aids, and you don't want to come out of this whole COVID crisis and now have a whole health crisis or a polypharmacy crisis where you're on 12 medications, mm-hmm. and it's going to be a mess to try to get you off. Mm-hmm. So just approach with caution and try to think more long-term. I know it's kind of short-term thinking right now, and I can't blame people. It's scary.
We feel it too. It's
scary.
Hard. It's really, and it's hard. It's really, really difficult. And, you know, this is, again, a whole part of the conversation. And this is what I often talk about with patients, and we talk about it together a lot, is that, you know, Adam being a pharmacist, me being a naturopathic doctor, often I actually try and relieve people's guilt from taking medications. You know, there's a lot of times where I say, it's okay, like, if, you know, people are struggling, like, it's okay if you use the cortisone cream in your kid. It's okay if you gave them Tylenol. It's okay if you take an antihistamine. Like, drugs aren't bad. Like, all drugs aren't bad. And I think sometimes there's this dichotomy of, okay, I want to go to the natural route or I don't. And so we need to be very clear when we're talking about, there's a lot of drugs that are not risky at all for trying or taking or utilizing when you really need them. But there's others that you should really start to question and really be aware of the potential for dependency, because, again, I didn't even know that as a practitioner. Only after you started really working with patients has it really become obvious how nefarious, I guess, these can be.
Yeah, and like insidious. They're very quiet. They're quietly harmful. And people don't realize how harmful they are until they try to come off of them. And then they're stuck. And they're like, oh my God, I have so much rebound anxiety and withdrawal trying to come off of this. And you'll see people, if they're on these for years, you'll see all kinds of strange side effects starting to happen if they try to come off of them, or even while they're still taking them and it's not a withdrawal. Like we've had patients with with something called akathisia, which is almost like a form of torture, which can happen with certain medications or withdrawal from certain medications, and it can be quite.
But these are like 20-year patients.
Not all. Like I would be very careful with benzos. Some of the strangest side effect profiles and some of the like strangest long-term side effects of like we have a few patients that like. I don't know if they're ever going to be able to relax the same way. And yes, a lot of them have been on these for years. But the long-term consequences aren't worth the short-term relief, in my opinion. And there's just enough options that you can... Again, I'm not talking about severe anxiety where you're having panic attacks. I'm talking about, potentially manageable or situational anxiety like during COVID. When you see someone that's not normally anxious or maybe... doesn't necessarily have an anxiety condition, but they're going through an acute episode of anxiety, which most of us are during COVID. To see them start on a benzo, like I can't help but pull them aside in the dispensary and just say like, hey, like I'll dispense this to you if you're really struggling, and I get it, and it's okay to take this for a few days, but please like be careful because like the majority of people that are on these long term, it's more of a problem than a benefit, than a relief, if I'm honest.
Yeah. And so, I mean, again, it's not about judgment. It's about bringing awareness to something that people really don't talk about a lot. And I think we kind of want to close off on this, really giving the message right now, not about like fear around benzos. It's about educating and, using...
No, I think there should be a little bit of fear of these. The same way there should be a little bit of fear of alcohol usage or drug usage to treat mood and anxiety. Like, there isn't enough fear around these. It's right in the guideline that you shouldn't be using them. We know what it does to the GABA receptor, and yet they're still quite widespread used. And I still hear prescribers saying to patients, oh no, you can just take that forever. They don't mention withdrawal. They don't mention anything, which to me is insane. And I would be very careful with that. But there's other prescribers that are well aware and refuse to do it. So, yeah.
It's a whole area.
It's a tough area.
It's a tough area, but hopefully this, if you're feeling stuck, there's other options. We got to talk about sleep. We got to talk about lifestyle. I know these are kind of boring things that aren't, and it's funny, right before we had this, right before we started this video, Adam was like, well, we should talk about some benzo alternatives. And I feel like the word benzo alternatives is very misleading.
Well, yeah, it's like a lot of things we do at NutriChem is like, it's hilarious that we have to talk about like diet or... some of these lifestyle things of like you should get adequate sleep, you should try to maintain your immune system, like all of these things that we've kind of been talking about lately where I'm like, well, that to me should be the primary. And then if you really are still struggling, then okay, use the benzo as needed. But like to me, it's crazy that the first line option is to use a benzo in a lot of cases. And it's like, oh my God, you're setting this person up for even more anxiety a month from now.
Yeah. Well, but the whole thing is that it's, when we try to say a natural alternative to a benzo, like benzos are so strong and so effective and hit your receptor so hard, you're not going to get that effect from something natural. And I think when you build up that expectation, people are like, it doesn't work. Right. I'm like, we need to calm your system down. It's going to take a lot. It's going to take consistent dosing. It's going to take a higher dose, a bit long-term. There's going to have to be changes that happen. And I think you probably hear a lot of that when you work with CBD as well. I get that feedback is that people are like, it didn't work for me. I'm still anxious. And it's like, we expect now, because of the strength of a lot of our medications, to take something and just immediately feel like a wash of relief. And I'm like, if something is strong enough to have that intense of an impact on you, then there's going to be higher risks associated with it.
That's always the issue with pharmaceuticals. In a lot of cases too, is like they're very effective acutely, but you will pay a price for that acute effect.
Yeah,
you will. Like you can't. There's no biological free rides. You can't slam the GABA receptor and be like, oh my God, I'm so relaxed now. Like, what do you think your body's going to do? You don't think there's going to be some kind of rebound or tolerance effect? Of course there is. There always is.
Yeah.
You can't just use the benzo forever and it works just like the first time. No drug works like that. That's not how drugs work.
Yeah, so before we kind of, and again, we don't really want to get into like stuff for anxiety, the specifics right now, but it's more about bringing awareness and then also about giving yourself, allowing yourself to let certain areas of your body or of your life slide right now. And I've been saying this to patients a lot, like, even with us, we were behind on doing this video. We picked a last minute.
Sorry, Sam, our social media girl's probably mad at us.
Social media.
Sorry. We're doing our best.
We're doing our best.
But we're letting ourselves off the hook right now.
We're letting ourselves off the hook.
And I suggest you do the same.
I've got my glass of wine right here. It's okay. It's okay, if your kitchen is a mess, but you choose to go for a walk and work out because you need that for your mental health. It's okay if you're not, you're scrambling and not packing the best lunch for your kid every single day. It's okay, if you're just kind of scrounging by and you feel like everything's just right about to fly off the rails. Like that's what's happening right now. And I think sometimes we put such intense pressure on ourselves, and we see so many people on social media. Everybody's struggling.
Which is always a bit of a lie. Everyone's always putting stuff on social. Look at how great my life is.
You don't even want to see your kitchen behind here.
Yeah, everything looks great on social media. It's not real.
It's a mess.
Everybody's struggling right now.
Everyone's struggling, and again.
And I say this just from talking to people every day, all day in the pharmacy, in the clinic. Everybody's having a hard time.
Yeah.
So you're definitely, same way everyone's like, oh, we're all in this together to crush the curve and bring down COVID. That's all great stuff. But we're also all in this together in terms of everybody's struggling with anxiety.
And some days are great. And sometimes you feel you're on top of the world. And other days you're like, I can't do this anymore. And give yourself a break on those tough days. Put your computer away, work can wait, go for a walk, prioritize, having something that feels good for you in the moment. And self-care doesn't have to be spa days and bubble baths. It can just be ignoring your messy house and getting outside or doing a workout or
taking a few minutes before trying to get to all of your emails. Yeah. I'm still talking to people that are still putting so much pressure on themselves. High performance at work, even though they're working from home. Or the
guilt of taking some extra time off or being at home. You're guilty for being with your kid, but then you're guilty for not being at work. It's this horrible vicious cycle. So
I think a lot of people are maybe learning to let go a little bit. I've seen a lot of articles on CBC about how a lot of people have had to let go during COVID because you can't control a global pandemic.
No.
I mean, you could do your part from a public health perspective of wearing your mask, washing your hands, social distancing. That's all important. But you can't, make this whole thing disappear, and you can't control everything. So,
and it's okay. It's okay if you decided to send your kids to school. It's okay if you decided to not send them to school. Don't let other people's opinions, everybody's getting the same information. So whatever people feel inside is right for them, that's the right decision. Mm-hmm. So that's kind of what we wanted to sign off for. If you're taking a benzo, don't freak out right now.
Just be aware that you might want to start having the conversation with your prescriber.
Exactly.
Or a pharmacist that can maybe work with your prescriber and yourself. This isn't meant to be promoting me. Honestly, I'm just a huge proponent of lowering.
He rants a lot about benzos because he sees people. We do tape.
I see people's lives destroyed by them.
Yeah. So. Yeah.
I don't really. Should I be less passionate? That seems a little.
No. I think it's good. I think people need to hear this.
Just like I see people's lives destroyed by alcohol. To me, benzos are just sort of a white collar, dressed up alcohol. That's all you're doing. You put it in a tablet. Great. You're still smashing the GABA receptor and causing problems. That's just chemistry. So I have to spread the awareness of please. I don't care if you use this for a week. You start getting into a month, 2 months. It's gonna get hard to come off of it. And you're going to have a hard time calming down. And I see people every day
is there a safe amount of time that's okay, if people use it for 2 weeks because
it's quite individual, but in general, if you can keep it to 2 to 4 weeks or less, and that's okay to use it. If you're going through an acute phase of anxiety or mourning, someone just died, I get it. Use some lorazepam if you need to sleep. That's fine, but it's like alcohol of okay, you can have a few nights of drinking or having a few drinks to calm down, but it's gonna start building up and you're gonna have some repercussions. It's not, again, there's no biological free rides. You're gonna pay a price for it eventually.
Okay. Yeah. Okay. Well, hopefully you found this interesting and helpful. As always, you can comment below. We'll put a couple articles below on benzos and resources. I like to post a Health Canada mental health resource kind of page called Wellness
I won't
Together.
even post studies. I'll post the Health Canada guideline that says you shouldn't use these past 2 weeks.
Okay.
And yet everyone does. So sorry, I get very frustrated with these medications.
That's okay. It's good. This is what we're doing. We're supposed to disrupt things.
And then I have to answer questions about the risks of cannabis. And I'm just like, wow, I'm in bizarro world sometimes. So forgive me if I get a little frustrated.
That's good. People want to see passion. That's why they come to you, because they want to see the truth. It's about presenting truth and the reality of what we see. So hopefully you found it useful. We'll post some stuff below. As always, comment if you have any questions. Have a lovely day, everyone.
Thanks.